Welcome to Diabetes Every Day. I'm Toby Smithson, a registered dietitian, nutritionist, and certified diabetes care and education specialist. And I have decades of experience managing my own diabetes. Please hit subscribe, it's free, and visit my website, diabeteseveryday.com. It's free too. Today's video might be a good introduction to diabetes management for newly diagnosed, or even a little straight talk for those who feel lost. I'm going to give you the 5 things you must do to protect yourself over the long term from the terrible things diabetes can do to your health and quality of life. Notice I said can do, and I most specifically did not say will do. And that statement takes us directly to number 1, accept responsibility. Like it or not, you are the person who determines the outcome. To be clear, I don't mean accept responsibility for having diabetes. That is an unhelpful guilt. What I do mean is that diabetes is a self-managed condition, and you are the self. It is you who can make conscious decisions to take your medications as prescribed, to commit to learning how to eat healthier, to make time for physical activity, to get adequate sleep. It is a job you didn't apply for and don't want, and the salary is terrible. But the fringe benefits are incredible if you accept the responsibility. Along those lines, number 2, stop looking for a magic answer. There isn't one. Right now, there is no cure for diabetes. There's no pill, no supplement, no magic food. With type 2 diabetes, remission is the best possible outcome. But possibility of remission depends on a lot of factors. One is how long you've had diagnosable diabetes before the actual diagnosis. The most important thing to know is diabetes can be managed if you're willing to make the commitments. You can maximize the outcome no matter where you're starting. Now, point number 3, no carbohydrate foods and portion sizes. It's not just sugar we have to manage. Fruits, starchy vegetables like potatoes and corn, beans, lentils, milk and yogurt, grains like bread and beer and sweets all impact sugar levels. Our job is to eat these in appropriate portions and appropriate times, and often along with other foods to minimize the impact on blood sugar. You simply cannot do that if you don't learn carbohydrate foods and their portion sizes. Okay, number 4, monitor blood sugar to get actionable information. I'm sorry, but checking once a day or simply at random times does not give you information that you can use to make changes tomorrow. Managing blood sugar means becoming a detective. What does having a reading of 275 30 minutes after a meal mean? Well, after meal readings will tell you a lot more if you also have a before meal reading. And remember that after meal readings should be 2 hours after the start of eating, unless you fear a low blood sugar coming on. Nobody likes the finger sticks, but it's particularly disagreeable if it serves no purpose. Finally, number 5, get your help from credible sources. You can literally find anything online, and your neighbor's cousin's friend might be full of diabetes advice too. Look for credentialed professional help, like support groups led by a certified diabetes care and education specialist, or online communities where discussion is monitored by medical professionals. You don't have to take this all on at once, but you do have to take it all on sometime. I suggest you start with 1. You can find a lot of information on this YouTube channel, on my website, or even in my book too. After all, it wouldn't be nice for me to dish out these commandments without providing a credible resource for you. Until next time, cheers to your health.